COVID revealed some significant weaknesses in our healthcare system and our long-term care system, both of which seem to be still challenged by staff shortages and the difficulty of attracting new people. What will your government do to ensure hospitals and long-term care facilities can continue to meet the challenges we face, particularly in this region with our aging population?
Absolutely. This riding has a higher density of older people than most other ridings in the province. It is a grave concern. But one of the things that I'm incredibly proud of, a few weeks ago, I actually attended an event where outgoing MPP Darryl Cramp had the privilege of announcing 800 new or refurbished long-term care beds in this riding alone. And it's a really notable number because in the previous 15 years under the previous government, there were only 600 beds built in the entire province. This government promised 30,000 new beds, and we're well on the way to providing that. They're either under contract or already developed. We need those beds. But you made a really good point in that the next thing we need to make sure we have is we need to have the staff, the PSWs, the nurses, all of the various healthcare allied services have to be available. And so we're boosting the training models. We're encouraging work with Loyalist College and St. Lawrence College in this region and across the province to ensure that we have more PSWs available, more nurses available, so that when these new long-term care facilities are built, we'll actually have the staff to make sure that our seniors are well taken care of.
Continuing the focus on healthcare, COVID revealed some significant weaknesses in our healthcare system and our long-term care system as well, especially early in the pandemic, both of which seem to be still challenged by staff shortages and the difficulty in attracting new people we talked about before. What will the government do to ensure that hospitals and long-term care facilities as well can continue to meet the challenges they face, particularly as we continue to have an aging population?
Yeah, so this was, I guess, a great example of the unpredictability of crisis situations. We went through SARS-1 back in 2003. I was involved with the provincial government at that time. There were absolutely lessons learned, and there was preparedness done. But the reality of this pandemic is that it was different, and things that we thought were the answer back then, things like Tamiflu. Nobody's talking about Tamiflu. That was the big deal back in the day. Did we let some of our inventory of supplies like N95 masks expire? Yeah, that was unfortunate. There were definitely lessons learned about the need to rotate inventory and to keep supplies fresh. But one of the big lessons learned was how to organize for a crisis. And unfortunately, the Ford government, when they came in, were not prepared. They had to hire McKinsey, big U.S. company, to figure out how they were going to manage it. We had plans in place. We had the incident management system already well understood. They ignored it. They created their own system from scratch, and they bumbled along. There's lessons learned. There's things we could do to improve. But the critical thing is that we have to have a civil service, and we have to rely on our civil service, on the professionalism in our civil service to help us, and not just let politicians run roughshod. Long-term care, I want to make mention of one key aspect with respect to long-term care. The Ford government, when they came in, stopped inspections. That was a huge problem, and it left certain homes in a terrible situation in terms of dealing with the pandemic, and as a result, we had the highest number of fatalities in our nursing home sector. You may remember the military had to come in, and there was horrific reports in certain private sector homes. It was appalling that the Ford government stopped inspections, and we suffered as a result.
One of the things that came out of that, too, especially with regards to long-term care is, and I know this because I know some people who were PSWs, is they weren't being hired on full-time. So they were doing piecemeal work, oftentimes working 2 and 3 facilities, and that was actually facilitating spread in the early days because it was those workers in some cases who were actually doing that. Is that an example of what you're talking about in terms of supporting staff for those kinds of facilities so they don't have to do that kind of thing and they can really rely on having a consistent, stable, and one-centered income?
So this is a great example of where a lack of expertise and understanding of how the system actually works creates, quite frankly, havoc. And this is something that is not unique to the Ford government. This has been going on for decades. There's a trend towards part-time staff where you don't have to pay benefits, You don't have to impose the same kind of union contracts and union requirements with part-time staff as you do with full-time staff. I've seen this happen. I can tell you that as a vice president and when I was a CEO, I've rebelled against this kind of, race to the bottom line, tried to do things as cheaply as possible. I think that full-time work with benefits is the right thing to do. You want to build a staff that is committed, feels respected, and is not trying to earn an income by bouncing from job to job. So we need to encourage full-time work and not this kind of part-time ad hocery. It's cheaper. It's what the private sector does. But at the end of the day, I don't think it's in the public interest.
COVID revealed some weaknesses, significant weaknesses in the healthcare system and in long-term care, as we've all seen, both of which are challenged by staff shortages, either by people leaving the profession or being difficult to attract new people to that sector. What would your government do to ensure hospitals and long-term care facilities meet those challenges, especially since we have an aging population, as does Hastings, Lennox, and Addington?
On the front of the long-term care, we believe in expanding home care options. So many seniors would prefer to age at home, and there's not enough funding for that, frankly. It's more cost-effective for someone to age in their own home as opposed to being in hospital care or nursing home care. So we want to make sure we expand those options for people that want them. When it comes to nursing home care itself, we want to humanize these facilities more. And there's a lot of evidence. There's the Canadian Association of Retired Persons has a great brief on how we can humanize these institutions to be more like home environments where you have a more patient-centric approach. You have smaller living pods that look more like homes as opposed to institutions. And there's some great examples here in this country and the United States about how we can revitalize nursing homes. So we would have basically a plan where nursing homes would have, say, 3 years to change their processes to make their service more patient-friendly, less institutional, and really fix the issues that we've seen during the pandemic.
So to see that difference from what nursing homes are now to what your idea is, there would be some adjustment and training there. Yeah. One of the more recent examples of sort of a success, if you will, is what's happening in Tyendinaga, where they introduced a program recently where graduating students can stay home or closer to home to serve long-term care. Would that relationship with post-secondary, as far as training goes, be ideal, or is there a better option to have that training for whether it be the current long-term care environment or a pod environment? Is there another option to make that more attractive?
Well, I certainly think that we need to make sure that we have significant staffing. To have people who are connected to communities, working in those communities, I think is very important. So I think that's a great program that they're doing there. As far as increasing staff numbers and staff loads in critical industries, our party has a plan to cut tuition significantly for those jobs that are most in demand. So whether it's PSWs or other skilled trades, we want to make sure that we're focusing our education investments on those careers that are in the highest demand in the province.
Maybe if you can provide a little more detail, how much of a reduction is there about, and I guess what other incentives are there as far as trying to bring not just new graduates, but former workers back into the sector?
For the careers in the highest demand, certain skilled trades, certain health careers, the tuition would be virtually free or close to free. For some of those programs that are not in high demand at all, we would be putting more of a burden on the person to be paying for that, or OSAP loans in that regard. So we want to make sure that we're funding education according to what's needed in the province. But for those things that are needed, basically free.
COVID revealed some significant weaknesses in our healthcare system and our long-term care system, both of which seem to be still challenged by staff shortages and the difficulty of attracting new people. So what will your government do to ensure hospitals and long-term care facilities can continue to meet the challenges we face, particularly in this region, not just Hastings, Lennox, and Addington, but Bay of Quinte as well, with the aging population?
Okay, the first thing to do is to stop disrespecting the people that work in these fields and stop cutting and cutting and cutting. You cannot cut your way to a proper healthcare system. You cannot cut your way to a good long-term care system. And the privatization of these long-term care or of hospitals is not the answer. It's been demonstrated that the hospitals that had the worst records and the most deaths during COVID were all private, the private long-term care facilities. So these are places that are just warehouses for old people. It's disgusting. We need publicly owned long-term care would take the profit out of it and put the care back into it. That's really important for our seniors. And I'm not that far away from being one of them. So we're talking about all of us out there need these services. If not for us, then for our parents or our grandparents. So the long-term care, the privatization of long-term care, which the Ford government is actively doing at the moment, is absolutely the wrong way to go, and is going to make for worse care for our seniors who built this country, who made it what it is today.
Absolutely. And staffing, too. There's a lot of, I've talked to healthcare and home care and long-term care. We know from earlier in the pandemic, they're dealing with staffing shortages as well. So what kind of incentives are you going to put in, or what kind of strategies are you looking to implement to try and attract people to these jobs? Okay.
I was canvassing in Bath the other day, and I met a young woman who was studying at the Queen's School of Nursing. She wants to be a nurse, but when she was put in a placement, she found that the nurses were rushed off their feet, that there were too few people doing too many jobs, and she, on returning from that placement, she transferred her major to kinesiology. She is not going to be a nurse, and that's a loss for Ontario. We're losing these people because of the cutbacks and the refusal of the Ford government to fund hospitals properly. So we've got to fund these places if we're going to have a healthcare system that responds to people, that meets people's needs.
Obviously, COVID in particular has opened some obvious weaknesses in our healthcare system and in our long-term care system. What would a Blue Party government do to ensure our hospitals and our long-term care facilities can continue to meet the challenges moving forward, especially in terms of attracting and retaining staff?
Did I tell you that this fall I'll have been an RN for 50 years?
You did not tell me that.
And I'm still current with my license. I'm not working in that capacity at the moment, but I still have a current license. So my career has brought me from places like Sunnybrook to hospitals like Campbellford to the federal corrections, Saudi Arabia and beyond. I've watched it. I was there for the discovery of AIDS, for H1N1, for MERS, SARS. The list goes on. You know, we did have policies in play for major endemics. They weren't followed this time around. I look at things like whenever any of these endemics were going on, we wore the personal protective equipment. Anybody did. And when you took it off and it went into a yellow biohazardous container, where does everybody's mask go now, and where has it gone from the beginning? Hand washing is what saved most of us. There were policies in play. They were ignored or abandoned or misplaced. I don't know which it was. We need to hire back the people, and it's not just the nurses. I mean, the PSWs, the housekeeping staff, the lab techs, the physios, if they'll come back. These people are the mentors that are going to bring the newer staff forward. A lot of them didn't leave because they didn't want the shot. They left. And I can tell you this for truth because I've talked to a lot of them. They left because the confidentiality was gone. Totally gone. And they were frustrated. And a lot of them were old enough that they could leave the system. Not because they were necessarily immediately ready, but they could financially leave the system. Those are the people that are going to give you the art of nursing, the art of medicine, the art of being a lab tech, as opposed to just the textbook science. That needs to be brought back. We need to reform healthcare basically from the top down. Long-term care, it needs to be reformed again from the top down. We need to take a look at for-profit versus not-for-profit. I'm not saying that I'm against for-profit, but I hear the Ford government say we're going to hire 20,000 PSWs. If you haven't had the for-profit institutions buy into the fact that their budget is going to change because of the PSW client ratio, those PSWs are not going to be hired. Those things need to be looked at. It took COVID to get rid of 4-bed rooms in the long-term care facilities and attempt to make them 2-bed rooms. I heard the other night that this riding has 800 new long-term care beds. My question is the shovel in the ground, or are the beds physically out there? Because every nursing home that had 4-bed rooms has probably dropped the number they can accommodate by at least a third. And I can name at least 3 or 4 nursing homes. To say there's 800 new beds is the shovel in the ground. And it used to be, I would have to look it up so you can't really quote me, that in order to build an institution or a facility like that, you had to prove that you could hire the staff to fulfill that facility. If that's still the case, I'm not sure where those numbers are going to come from. We're struggling already. I took a look, Napanee Hospital, 20 vacancies right now, and that's in nursing. We've got to change.
You talked about the need for change. You talked about the need to change from the top down. Can you give me some examples of what change you think you and the Blue Party would start with?
Well, in the hospital sectors, one of the first things we have to do is eliminate the long wait periods for anything, whether it's waiting to go in to see an orthopedic specialist or waiting for cancer treatment. I mean, so many people have suffered for so long. And in the beginning of COVID, the fear factor was there. People didn't go to the hospital. We've got to eliminate that somehow, and it's going to take a bit of work because mainstream media has done a wonderful job the last 2 years. No offense. Long-term care, we need to look at how these facilities are run, and make it more streamlined and equitable among all the long-term care institutions. These people are in these facilities because they need to be. I've never met one elderly person that said, when I'm 80, I want to go to a long-term care home. They'd love to stay in their home as long as possible. We need to make it as home-like as possible. There are a few strides being made with activities and such, but COVID really took care of that. We also need to really take a cold, hard look at how our home care is run. For years, home care staff were never paid the same as people in the hospitals or the nursing homes, because many people could stay in their home longer if we can organize that aspect of the healthcare system. But it all needs to be tied together. Well, then we can go on to mental health and addictions that has been in trouble for many, many years. And that really needs to be looked at. And because of COVID, the numbers that require that kind of help or treatment are ever increasing. So it's got to be a sit down. It's got to be a grassroots. And how be we try something really innovative and get some of the people that are part of the front line there assisting with suggestions on how to fix this.